Hello, I'm Dr. Rick Chambers, and I'm going to talk about a presentation I did last Friday, and the title of the presentation is From Mental Health to Behavioral Health. It was a 1-hour training under the heading of the biopsychosocial model of therapy. The conference was organized by Dr. Lewis Boynton. It was offered through West Georgia Licensed Professional Counselors Association, and it took place at a University of West Georgia facility. However, the views expressed in this are strictly my own, so no one else that participated in this kind of has any responsibility for this. But in the presentation, I gave a quick history of the mental health profession as told by insurance cards. There's a number on your insurance card that says what to do if you want to see if you need mental health counseling or want to see a counselor. In the beginning, there was kind of no mention of mental health on the card. Then a number appeared on the back for mental health. Then a number appeared for mental health and substance abuse. But currently, most cards now have for behavioral health. There's a number to call, and if you call this number, you are directed to a list that includes licensed professional counselors. So did mental health disappear, and what took its place, and why? In this 1-hour presentation, I just wanted to start a conversation, and I think it's a conversation with implications for the entire field of counseling and for the general population. And even with this video, I'm just trying to start a conversation. But at the end of the conference, because of the discussion during my presentation and the context provided by other presenters who were discussing issues around involuntary commitment, legal and ethical issues around training, practice, and supervision, I came up with some new questions. With this change from mental health to behavioral health, did anything change in the areas of theory and conceptualization of counseling and the role of the counselor? Training and supervision, daily practice, payment, reimbursement, business models, economics, ethical and legal standards, and professional identity. The intent of the presentation was to make the case that behavioral health is a dramatically different model from mental health, especially the medical model of mental health services. The medical model of mental health requires the diagnosis of an illness, syndrome, or dysfunction based on symptoms. This leads to procedures, intervention, and treatment, which should lead to symptom reduction and/or cure, leading to the ending of services. Oh, and somehow everybody has to get paid. The idea was to present behavioral health as a model more closely aligned with the process of growth and development shared by all humans, rather than a medical model just for people who need mental health counseling. The hope was to change the way licensed professional counselors think about and practice therapy. And part of this was fast, successful, and easy. Making this case was very easy. All it required was 2 bullet points from Dr. Jason Satterfield's guidebook on the course Mind Body Medicine, The New Science of Optimal Health. The bullet points were from Lecture 2, Vital Signs, Defining Health and Illness, in the section Determinants of Health. These bullet points: behavior accounts for approximately 40% of premature mortality. Genetics accounts for 30%, while social factors account for 15%. The environment accounts for only 5%, and healthcare accounts for 10%. Together, behavior and social factors account for about 55% of premature mortality. But we're currently spending about 5% of healthcare dollars on behavioral interventions, despite the fact that they account for 55% of premature mortality. So it seems the case would be easy. But I told the group, now there's a slow, hard part, And I mentioned one of my favorite t-shirts that shows a person jumping from one rock to another. And it says, confidence, that feeling you have right before you understand the situation. It will probably take 20 years before LPCs can work full-time in a behavioral health or other growth and development-based model rather than within the medical-based model. However, I also believe that in the next 20 years, mental health as we now conceive it will be so altered as to be unrecognizable. This is going to require changing theory and conceptualization of therapy, counseling, the role of counselors, training and supervision, daily practice, service delivery, and having different conversations within the therapy session itself. It will require changing legal and ethical standards, professional identity. A reasonable goal, or a way to do it, this won't be done all at one time, but a reasonable goal would be to convert 5% of your actual practice and reimbursement a year from mental health to behavioral health, or a developmental growth and developmental model. I wanted to present from mental health to behavioral health as a journey or a narrative that changes through time. And one quote that's part of it's also a narrative of wholeness principle is, people don't change, they grow. This is not going to be just change for LPCs, licensed professional counselors. This is growth and differentiation of the field. And the case was easy to make because most LPCs are already accepting of this model as individuals, and they are ready for a new model. Most of the public is already there. I didn't have to make the case. People are already there. The public is demanding a new model. But there is no infrastructure to enable the new model, and lots of infrastructure preventing its growth. There's no path, trail, system, business plan in place. There are legal and ethical complications. This is going to be how to bring the social and cultural more in line with what individuals already believe in their heads and what individuals have already accepted. There's not even a safe, economically sustainable way to experiment to even find the paths. Another narrative of wholeness principle is the path is made by walking. What I'm calling for, or would like to ask people to participate in, is a massive local, safe as possible experimentation for networked, real-time modeling, applying a growth and development model for psychology. And it will happen, this is the communiversity model, it will happen by creating very small, very local communiversities. Educating individuals toward health, happiness, and harmony, and training of health, happiness, and harmony partners, 3HPs. 3HPs will have access, actually everyone will have access to a curriculum or set of cognitive maps to help with orienting and navigating toward health, happiness, and harmony. This curriculum we call our narrative of wholeness. There are other ways of presenting this communiversity model. We're adapting the work of Robert Keegan to help individuals, families, organizations, and especially geographical communities become deliberately developmental. In the same way as universities are organized around knowledge, communiversities are organized around individual meaning. It is an educational system with no other purpose than helping individuals in their journey toward health, happiness, and harmony, using health, happiness, and harmony as navigational beacons and the narrative of wholeness as maps of meaning. Now, this begins to intentionally apply the work of Jordan Peterson, Joseph Campbell, and Carl Jung. Another way you could say it, we're educating toward wholeness. Another way, we're educating in the science, art, and craft of living. The narrative of wholeness includes maps for helping individuals do their soul work. This is applying the work of James Hillman, Richard Tarnas, Becca Tarnas, Abraham Maslow, and original work by Rick Chambers, and many others. And what we would like for people to do, if these ideas are intriguing for you and you would like to help craft this emerging narrative, by beginning to organize your own local and networked communiversity, please contact us through our website, livethegoodlifenow.org. Thank you very much for your time.